You're watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. He is Kansas City's go-to implant dentist, Dr. Brandon James. Dr. James, welcome to the program.
Randy, good to be here.
Now, you brought a lot of photos, so we'll get to as many of those as we can. Now, for people that don't know your practice, like who's the typical dental implant patient?
Yeah, so I would say there's not a typical one-sided dental implant patient, but they do fall into two categories typically.
Okay.
First of which being people who are coming in who still have their teeth, whether it be some of their teeth or missing one or maybe a majority of their teeth. And those teeth have started breaking down perhaps. They've been through a multitude of dentistry over the years, crowns and root canals and periodontal surgeries and therapies that maybe are failing now. And so, or maybe they have periodontal disease.
Okay.
What comes with that? It's things like, bad breath and, with periodontal disease. What periodontal disease essentially means is that we're losing the foundation around.
Is it a gum infection?
It is a gum infection. I mean,
Okay.
we'll call it what it is. It is a true infection, but the teeth now don't have near as much support anymore. And so maybe they're loose, maybe they're mobile and moving, and so you can't chew or you can't bite into anything anymore. Or maybe they flare out a little bit, and so it becomes a cosmetic issue for people at times. But essentially, these people are looking at, they have their teeth, but whether it be in another dental office or whether they've done their own homework on Google or whatnot, whether it's been told or whether it's assumed, they feel like their next step is, I know my teeth are bad, I know I'm in trouble, and really the next step is a denture. And so what do? They kind of ignore the dentist for as long as they possibly can.
Okay.
And so it may be years since they've seen a dentist and they'll say, well, yeah, I went to my dentist 8, 9, 10 years ago. They told me, probably the next step is going to be in dentures if I don't shape up or ship out.
So they come to you because they don't want dentures.
They don't want dentures. They're scared to death of that. And so they're, because to them, a denture is what grandma and grandpa or mom and dad had in a cup sitting by the bedside, and so they don't, they don't know what options are out there available to them other than they have this fear of what life was potentially like or their assumed life with dentures. And for those patients, we can give them a new set of upper and lower set of teeth, fixated in, do not come in and out on dental implants.
Okay.
So the second set of patients that come into play are in fact those patients who are already wearing a denture. They've already had their teeth removed. To put my dental hat on, they're completely edentulous, which means all of our teeth are gone. Okay. We're now we're living life with a denture, and quite frankly, they're unhappy with the lifestyle that kind of naturally comes with a vast majority of dentures. That is essentially, loose-fitting dentures, dentures that people always talk about. I don't know that I've met a denture patient in recent time who hasn't said in one facet or another, I can't taste foods near like I can.
Okay.
And it's not essentially that we're taking away or we're covering a lot of their taste buds, but what we are doing is we're sticking a big piece of plastic in the roof of their mouth. So maybe it's gagging to them, maybe it's gaggy. But it's really taking away the enjoyment or the perception of taste. If you're that hot cup of coffee in the morning going over the roof of your mouth, if you're a wine connoisseur or enjoying a nice red wine or something, or not having that perception, really takes a lot of the enjoyment away from them, okay? And for these people who are wearing dentures currently, then in one day they can come in and we can take them from that denture and give them fixed upper, lower, whatever they need, whether it be upper, lower, or one arch at a time, fixed implants, supported teeth that, again, do not come in and out.
When you say fixed, we're talking about teeth that don't come in and out.
Don't come in and out.
Now, when you said on the day of the procedure, if you're wearing a denture, you could walk in that day with no teeth and walk out the same day with upper and lower teeth that don't come out.
You bet.
Is that right? Correct me if I'm wrong on this. At your center, the way dental implants, I guess, are typically done are in 2 or 3 different locations. You go to one place where they do the dental implants, another place where they put the teeth on top, get them maintained elsewhere. At your office, you do all 3 parts. Is that why you do it so quickly?
Yeah, I would say that's a fair statement. But beyond the quickness side of it, which is important to people, I get that, and I think we can definitely be much more efficient in that model, which is essentially why we developed that model. But even more importantly is that, one, it's 2 specialists under the same roof. I think that's very unique in our community. and you're getting the highest level of care that you possibly can with those two specialists at your side at the same time, as opposed to, as you referenced or alluded to, going to one surgeon's office and then having to get in the car and go to your tooth doctor, or what's called your restorative doctor in another office. We also have dental laboratory technicians, which is a very important part of the
You actually
teamwork.
print the teeth. You make them right there?
We do a full digital workflow in the practice. So once your surgery is done, we will do intraoral scans, so no more goopy impressions.
Okay.
And then those teeth go directly into the printer, which I'm doing myself. We're not farming that out to somewhere across the country or anything like that. But again, does that improve the efficiency side of it, which in turn mitigates or minimizes the overall amount of treatment time? Yes, it does. But more importantly, Randy, is that it really helps us control the environment, because there's a high level of communication all across.
Okay. So where you are, like in the Kansas City area, are there a lot of people either wearing a denture, headed to a denture? Is it a big problem?
There absolutely are. And looking at latest research from the American Dental Association states that 36 million Americans are completely edentulous, meaning without any teeth.
Right?
Of which that's about 10 to 11% of the adult population. Now, when you look at Kansas and Missouri, which is our metropolitan suburb, that 10 to 11% is actually up as high as 18 to 19%, depending on what.
So tens of thousands, more than 100,000?
Tens of thousands. In our world, I mean, we have Kauffman Stadium where the Kansas City Royals play.
Yeah.
36,000 people. You could easily fill that stadium up
right?
with denture wearers. One step further, Arrowhead Stadium across the street where the Kansas City Chiefs play, 75,000 seat stadium. You could fill that one up as well with these denture patients who are struggling, and they just simply, many of them, I think, just don't know what their options are.
So if it's so good, then why aren't they all doing it? What's your take?
Yeah, I think there's 4 or 5 answers that come off right off the bat. The first of which, we've kind of already alluded to it a little bit, is that the fact that these people simply, they don't even understand what their options are. They've kind of in the mindset of settling, assuming that, well, I have a denture now, that's the end game.
So they don't go to the dentist?
They don't go to the dentist.
Okay.
They're out of the ecosystem of the normal communication of dentist and patient communication.
Okay.
In a lot of our offices, and including mine as well, patients get into being a denture, and yes, we'd like to see them on a yearly basis, but they don't show up. Because they don't think there's anything that can be done with them. And so they've gotten into this mindset of just settling for what their life is like. And that's just the end all be all, which it doesn't have to be that way. Another big one that comes up all the time is, Dr. James, that's a great solution, that's a great option, but I'm 80 years old, I'm 70 years old.
Well, how old can you
65.
be to do this?
Yeah, Randy, I don't think there is an upper range, to be honest. I don't think there is an age that limits you. We've treated a 93-year-old patient.
Is that right?
Had an upper denture, struggling for many, many years, treated him with an upper set of implants and fixed teeth. And for the latter, several years of his life, he was eating everything under the sun, smiling again. Personality came back, charisma came back.
Okay.
Family members, because we see his family members as well, including his son Jay, and saying that Dad was his old self again. And yes, maybe he didn't get 15 or 20 years out of it, but he did send us a note saying those last handful of years, Dad lived more in those times because of eating and the relationships. Because that's what we're all about, is a lot of relationships, and where's that done? Over a nice meal, of enjoying that. And so, yeah, it was a really good feel-good story, but it taught me the sense that I don't really think there is an age.
So 80-year-olds routinely?
80-year-olds. We currently have a patient that comes right off the top of my head at 88 that we just finished up.
Why would they want to do this?
Because, Randy, when you're 88 years old, what does your life revolve around? It's eating meals, enjoying life with your friends and family, relationships around the card table or the poker table, and it's a lot food related. And so these patients, it gives them the ability to simply put, to continue living the maximum quality of life that they
So when a
possibly have.
70-year-old is in your office and says, Doc, am I too old? Not even close.
Not even close.
Does that ever happen where people like in their 70s think they're too old?
All the time. But from my point of view, a 70-year-old's got a lot of years left, a lot of years of living. And it's, the question needs to be asked, no matter what age you are, what do you want your years that you have left on this earth, whether it be 10, 30, or 50, what do you want those years to be? And if you want the highest level of quality of life, which I think you deserve as a patient, that's where
being able to eat healthy food, things like that.
You're investing in yourself for quality of life. Yes, we're talking about dental implants, which are little titanium pegs that support your teeth, but going beyond that, taking my dentist hat off, putting a people hat on, it's about giving them quality of life.
Eating, self-esteem.
Self-esteem, their personality, their charisma and their personality comes back to life. They're not.
Do you think this is the future of dentistry, whether it's 20, 30 years from now, where dentures as we know them today won't exist, they'll all be attached to something? Do you think that day will come someday?
I would hope it would. I will let you in on a little secret, Randy, on the dentures part of it. Denture fabrication is kind of a lost art, to be totally honest with you. So a lot of these dentures that we see in patients, they're ill-fitting, they're loose, they're moving around, they're painful, they're hurting, and patients simply just give up. They stop doing, they stop going out at night, they stop going to restaurants.
That's what they tell you?
100% every day.
Is that right?
And essentially, they're stopping living the lives that they want to.
And so that changes once they get their teeth back?
That changes immediately.
Is that right?
Once they get their, and we see it time and time again. And that's, selfishly for me and for us in our practice, that's what it's all about. It's about giving our God's gifts and abilities to affect positively a changed life.
Very nice. Now you brought some photos. What are we looking at here?
Brought some photos. Yeah, let's look at this gentleman first. This is Tom.
All right.
So Tom is a newly retired gentleman when he comes to us, a corporate man, and as you can see in the photo, missing multiple teeth. He's kind of had a hodgepodge of dentistry over the years. Teeth are starting to fail. Some periodontal disease issues is starting to be ill-affected. Tommy, actually, he was the one that mentioned to me that he's like, Doc, I don't know that this really makes any sense to you, but I'm tired of people asking if I'm angry all the time. Because he was just like his demeanor and his personality, he was just so protective. He kind of always talk like this. I think that's a fair assessment. Okay. Lack of self-confidence and maybe even self-worth. And he's a gentleman looking into his retirement in his golden years of all these things that he wants to do, travel and enjoy food and beverage, and just his teeth are simply holding him back from having the quality of life that he has. And so, talk about options. One option obviously would be a denture. And there's just no way that's going to provide the quality of life.
He wasn't going to go for that.
Not going to go for it, nor do I think he should have to. And so what we did for him, we gave him an open and over set of teeth on dental implants. And Randy, I want you, yes, the teeth are pretty.
I'm not trying to side with you, but it looks good.
So I want you to look at his face, Randy. Do you think he looks happier?
Yes.
Would you say he looks more sophisticated, educated?
That's true.
If you were hiring this gentleman, which one are you going to pick? Type of thing. And it's really in the eyes.
He looks younger.
I think he looks younger as well. I totally agree. But it just the beauty of this procedure is it's really transformative.
Is he limited on what he could eat?
Not at all.
Could he bite something like a raw carrot with his front teeth, or you have to be careful with the front teeth?
For the first couple of weeks' time, when the implants are healing, then yes, there are some limitations there that we have to be cautious of. Okay, but at Tom's stage now, when he's done, he can eat whatever he wants. He is back to living the life, and his teeth are not going to be a hindrance to him, whereas before, both from, again, these external things that we see as far as the teeth themselves, but more importantly, the internal things, the self-confidence, the self-worth, the youthfulness of his smile, the vigor and charisma of his personality. Those are the things that are really cool to see.
You say that they all regret the same thing. That why didn't they do it earlier?
Not doing it earlier, absolutely. So next patient we got here.
All right.
Susan. Susan came to us with a whole bunch of old dentistry that she was unhappy with cosmetically. Root canals and discoloration, couldn't eat comfortably. Her teeth were starting to become mobile from periodontal disease. This was a patient who was concerned with some of her relationships with her loved ones because she felt like she had bad breath and she was really, really self-conscious about.
So the gum infection causes the bad breath?
Absolutely, all the bacteria that is in there. So what are her options? Her options are to go through highly sophisticated dentistry to try to save as many of her teeth as possible. In her situation, we weren't going to be able to save a lot of the teeth because of the level of infection and gum disease around there.
Okay.
And so it was elected that we could give her a much better smile and a much more predictable long-term solution by going with teeth on dental implants, which is essentially what she elected to do. And this is her after.
Oh, wow.
And again, I would ask you a lot of the same questions. Certainly, youthfulness has come back.
Yeah.
Giving her more tooth display. And obviously, yes, notice the after, how the teeth that have been uniquely designed only for Susan, they cradle the lower lip almost perfectly, I think. Giving her more tooth show and tooth display so that you see more teeth, which is a much more youthful and vibrant
does look good.
Smile. And again, beyond that, it's just knowing her, knowing Susan, knowing the personality that's come out now. Again, looking at the eyes, looking at how she's proud of what she has. Let me show you this next photo, Randy.
Okay.
This is Bill. Bill is one of my favorites as well. Bill came into the office, and honestly, a lot of us, we didn't think he had any personality. He never showed his teeth at all. The smile that we'll call it a smile that you see there was incredibly forced for Bill. He didn't show anything because his teeth were severely worn down. But again, in one day, providing the new smile for him, upper lower dental implants, to where.
Let's take a look.
Taking a look at this after. And one of my favorite,
very nice.
Just from a natural standpoint, you can even tell, I mean, he's kind of learning to smile still.
What do you mean by that?
These patients, they're so protected for so many years of guarding what they don't like about themselves. We know from science, if we don't like something about ourselves, hair, teeth, nose, face, we're guarded, we protect ourselves from that emotional trauma, if you will, but it also holds us back from many, many things. And so
his smile will get better, you say?
Oh, absolutely.
Like he'll start opening it up more.
As he learns with just trusting the process, and he has to kind of relearn these habits of not having to hide and protect this behind the drapes of our lips anymore. And Bill, I mean, he comes in now just to say hi to the girls and to the team. And it's been a fun transformation for him. It really has. And, aside from these other things that we talked about from an aesthetic standpoint, probably one of the most important things about Bill is that he's now eating so much healthier foods. He can eat fibers, and he can eat all these proteins and things that his doctor wanted him to do because of some other systemic issues that were related to maybe some poor diet from a lack of being able to eat properly with what he had before. And so that's been a really nice and really cool thing to see related to his uniqueness of his story of being able, of what the teeth have provided. Yes, they provided the avenue, but giving him the ability to properly nourish himself, and it's had a systemic effect on him, as a positive systemic effect on him as well.
Now, what if somebody has bad gums? The gum disease, as you are saying, periodontal disease, gum infection. Are their gums too bad to get this done? Can they do it?
Absolutely they can, and no, they're not too bad at it, not at all. The gum disease, once you clear that up, the bacterial infection really has to do with the tooth roots and the teeth that are.
That's where it lives. Okay.
So we can get all that cleaned up, get them back to significantly better health. That not only affects their mouth but also affects their full body.
So by definition, they are healthier because they don't.
100%.
The infection's gone.
Bacteria goes away, bad breath goes away, and so there is a lot of super positive results that come from this procedure.
So you can't really brush and floss and gargle this infection out.
No. Well, once periodontal disease sets in, that's when you have to have professional help from your dental provider.
Time for more photos.
This is Deb. This is actually one of the sister-in-laws of a team member of ours, and Deb was wearing this denture that you see in the photo for many, many years, and she thought it was a very aged look. This kind of goes back to my story I told you about dentures kind of being a lost art in our field, and so a lot of these patients come in and they just accepted it for the result, but they looked aged. Her, kind of the nose and chin touched too close, and so it's a very aged look. And so what we did for her, again,
what did you do?
Upper lower set of teeth on dental implants. And this is her after that, giving her a broader smile, cradling the lower lip, giving her certainly more youthful smile, but giving her much more tooth display and volume, filling out her what we call the buccal corridors, which is the width of the smile, giving her a nice. Her comment actually, I want a Julia Roberts broad, full smile, and again, not to beat a dead horse, but focusing on her face beyond the teeth, of what it provides for her, just in her eyes and her kind of vibrant personality. It just gives her the ability to come out in her true charisma and her true personality. And yeah, Randy, with this, when we talk about what she's able to do and not to do with this old denture.
The before photo.
The before photo. She would never be able to bite into something of any consistency, say a raw carrot stick or an apple, or some hard, crispy, crunchy pizza, thin crust pizza or something like that, because it dislodges the denture and it causes it to tip and rock around. Well, now she can do all that, corn on the cob.
And this is the sister-in-law of one of your employees. What's the follow-up? What's she like now?
Oh, she's great. I mean, she liked us, or she loved us before because of the family history, but now she just thinks it's the greatest thing. And she's another one that's like, gosh, I just wish I'd have done this when I was 40 instead of waiting until I think she was 54, 55 when she did.
Now, for people wearing dentures, I want to ask you this question. Isn't it true? I mean, if you've been wearing a denture 10, 15 years, you can't do this, you don't have enough bone.
Not true at all. We've got this one patient who's, I think, 34, 35 years of denture wearing history, who's now walking around with dental implants with teeth that stay put, do not come in and out.
So it doesn't matter.
So it doesn't matter. I mean, you may have been told by another office that you're a non-candidate because you don't have enough bone, but that is just due to that clinician or that dentist level of experience, if you will, what they do in their own office. In our practice with Dr. Camerata and in our team, there's much more sophisticated options that are out there that we're trained to do.
So do you have patients that were told you don't have enough bone elsewhere, and now they have upper and lower teeth that don't come out?
We've had a multitude of them. And again, it's nothing against that dentist at all. It's just simply where they are in their level of training and their level of understanding.
Do you have a bit of an unfair advantage, like the fact that you have an oral surgeon as your business partner and you, the specialist, the prosthodontist, working together?
Yeah, I mean, I think we do. I'm spoiled, I think, in having the surgeon, because it's the level of communication is just so important for the overall execution of these cases that, we're talking about a lot of great success stories here, and there's a tremendous amount of success stories out there. But we could also talk about non-success stories too, and that purely comes down to a miscommunication on some behalf.
Having to go to too many different offices.
Too many
to get
offices,
just one thing
too
done.
many cooks in the kitchen.
So it's like one set of doctors, one fee.
Yes.
Right there.
Correct.
Okay. Now I'm going to rush you because I know you have a few more photos left and you want to get them all in.
Sure. So here's Linda.
All right.
And this Linda is a very common denture patient that you will see. Again, that's the best smile I could get out of her. Many years of denture wearing. I think 23, 24 years if I remember correctly. And Linda very rarely wore her denture around. She would only wear it if she was going to church, going out to the supermarket somewhere.
Okay.
But as far as at home or even when she was eating, she ate without the denture because it was just less of a pain.
She just ate with just her gums.
Just with her gums. She made it work. Made it. But obviously in that scenario, there's a lot of things she can't eat, a lot of nutritious foods that she can't eat. So during the consult with her, and we were going through her plan and what we'd like to do for her, she decides she's going to go for it. And so I'm really excited at this point in time because I actually have a vision of where this is going. She thinks it's going to look good, but she doesn't really know the transformative nature that's going to happen for her overall persona, personality, and charisma. I want to show you this. This is one of my favorite afters. And again, just with, that's her smile now.
So those upper and lower teeth don't come out?
Upper and lower teeth do not come out. She's got 6 implants on the top, 4 or 5 on the bottom, I believe, and those teeth do not come in and out. But now, oh my gosh, her face is just alive again. Her eyes are happy. It's one of my most favorite patients that we've had. So again, beforehand, she was eating food with no teeth, essentially.
Just her gums.
Just her gums. Mashed potatoes, cottage cheese, soft things, pastas, those kind of things. Now she's eating fresh fruits and vegetables and corn on the cob, and in Kansas City we love our ribs, we love our barbecue. So she's enjoying all these things that she had just simply given up on and thought, I'm never going to be able to do that. And so So no more dentures. No more dentures.
I want to ask you this too. if it's been determined all their teeth have to be removed, or if they're currently wearing a denture, what are the steps to getting the new teeth on top of dental implants?
Yeah, it's easy, Randy. Three steps that we have with a fourth bonus step that I'll throw in at the end. Step number one is simply come in. Give us an opportunity to discuss with you. Find out what your options are, hear your story, hear what's important to you, and how we can be a part of laying out a plan to get you to where you want to be, to live the quality of life that you want for yourself. Step number two is, what I think is the fun part, is we start designing your smile within our digital workflows, with utilizing a lot of really cool technology that you're going to be an active part of determining what type of smile you have, and that bespoke, unique smile that you have always dreamt of for yourself. And then third is the day that you get your new teeth, upper lower teeth. Fourth that I kind of threw in there is maybe now you have to rebudget for a better lifestyle and a better food budget. For
going out to eat all the time.
You're going to be eating a lot more than what you did before. But.
All right, now final message. Somebody watching this, they've heard what you have to say, but for whatever reason, maybe they're scared, they're skeptical. What do you say to them?
We'd love to talk to you. I would tell you that I believe there is hope, and maybe you're hearing that for the first time, but I do believe there is hope. There does not need to be life with teeth that hurt and are painful all the time, that are mobile and loose. You do not have to live life with bad breath and hiding behind your teeth all the time. I believe your smile should be an asset to your personality, not a hindrance to your personality. And all these things can be done by simply taking that initial effort to say, you know what, I would love to hear what we have to say.
So just learn your options first.
Know your options, learn your options. And yeah, we would love and be honored to be a part of your story.
Now there is one thing though, I guess the only drawback is the pain. It seems very painful.
Randy, it's not they're numb. They're numbed up. We offer sedation options for if you have a fear, if you're anxious about the process, we'll talk you through that. We'll hold your hand the entire time. It's just not something that we simply see as a major deterrent for hundreds and hundreds of patients that we've treated today.
And afterwards, some people just take over-the-counter remedies?
Yeah, I mean, everybody's different, but a lot of patients will move into over-the-counter anti-inflammatories, not major narcotics. I mean, this is not a procedure where we see that you're down and out in Beverly Hills for 2 weeks, 3 weeks, dreading and saying, why did I do this? It's just not what we see with this procedure at all.
And they have very little memory of the procedure with the sedation.
Especially with the sedation, yeah. It's just like, any other procedure that you maybe had in that you don't really remember anything about it. So it's great.
Now, if somebody wants to make an appointment, do you prefer they go to the website or just call your office?
I would say just call the office is probably the best. So, I mean, either way is fine.
Good. I want to thank you for coming to the show. Good stuff.
Thank you, Randy.
You've been watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.